Now, let us look at another discussion of drugs, and that is now we have to look at it. Commonly used drugs, and that is an example is the non-steroidal anti-inflammatory drugs. That's analgesics, non-steroidal anti-inflammatory drug, that's analgesics and anti-inflammatory drugs, which are very commonly used in our setup. So in this case, analgesics are drugs that selectively relieve pain by acting in central nervous system or peripheral pain mechanism without significantly altering consciousness of a person. So anesthesia is means that loss of sensation, and the anesthesia one brings about the loss of all modalities of sensation, particularly pain, with a reversible loss of consciousness. And then pain is an unpleasant sensory and the emotional experience associated with the actual or potential tissue damage or described in terms of just damage. So these drugs are classified into two: opioids, analgesics, that is narcotics, morphine-like analgesics, and non-opium analgesics, then steroid different drug like narcotic and aspirin-like analgesics. So the history of opioids is that it is got from the popular Venezuela capsule called opium, known from the other times. It is meant only in the Hebrews papyrus in the 1500 BC, and in the writing of the Theophilus 300 BC, and in Jaren 2nd century after death. So Santana and the pharmacist isolated the active principle of opium in 1806 and named it morphine after a Greek god of dreams of Morphus. So opioids, analgesics are natural opium alkaloids, that is morphine and codeine, and semi-synthetic opiates are like diacetylmorphine and oxyramorphine and propofol. Synthetic opioids are pethidine, fentanyl, and methadone, and also dextropropyl spin. The epinephrine and the tramadol is also another one type of synthetic opiates. So, non-opioid analgesics, anti-inflammatory, we have the non-selective COX inhibitors like salicylic acid, like aspirin, salicylate, and benzoate, and diflunisal. You have pyrazole and relatives like penyl butazone and oxpenyl butazone. We have propionic acid relatives like brufen. You have naproxen, ketoprofen, and phenolphrofen, and flubuprofen, and oxaprozopine. We have either relatives like indomethacin and sulindac. We have anthranilic acid relatives like methylenic acid and mefenamic acid. We have iron acetic acid relatives like diclofenac and thalidomide. So oxcam relatives pyroxcam and tanoxcam, and pyrrole relatives like ketanolalic. So the preferential COX-2 inhibitors like the mucilide, meroxicam, and the methoxam, and also you have selective COX-2 inhibitors like valdecovics and serocovics and the profecovics, COX-2 inhibitors. So analgesics with equal anti-inflammatory actions like paraminocepho, like that is paracetamol, acetaminophen, and perazolone, relative like metamizole and bupropion and benzodiazepinic and relatives like nefopam are examples of analgesics with poor anti-inflammatory pharmacological actions. They work on the CNS and they cause depressant and stimulation actions, and the cardiovascular system. They cause vasodilatations, and in GIT they cause constipation. In smooth muscles they cause increased ureter contraction and bronchoconstriction, and in autonomic nervous system they cause mild hyperglycemia. So adverse effect is that the analgesics dose are usually tolerated, and but the anti-inflammatory dose are usually associated with the adverse effect, which can take longer if it's taken. For example, in the GIT, it can cause epigastric distress, nausea, vomiting, erosion, gastric peptic ulcer, increased occurred blood in stool, It's very common, and it also can make somebody want to have vomiting in the brand, all those type of problems. So allergic reactions are not common and may be manifested as paralysis and photosensitivity, like examples. So it can also cause hemolysis, nephrotoxicity, and layer syndrome, and salicylic and acute salicylic intoxication is the adverse effect of this type of drug. So the functions of non-steroidal anti-inflammatory drug is that they alleviate analgesics by working on the point of prostaglandins by using hyperergic by affecting the transduction property of the free nerve endings, which is a stimuli, which is not normal pain and are able to do so. So non-steroidal anti-inflammatory drugs not affect the tenderness induced by direct application of prostaglandins, but block the pain sensitization mechanism induced by bradykinin. You know that bradykinin, it works in it uses pain, bradykinin and canine and outer points. You know that even bradykinin is a good one. So the other one is antipyrexics, non-steroidal anti-inflammatory, which causes reduced body temperatures in fever, but not cause hypothyroidism in normal thematic individuals. Non-steroidal anti-inflammatory block the action of proergenic, but do not prostaglandins in the hypothalamus. So it causes anti-inflammatory effects. Also, it causes antipyretic aggregations due to inhibition of prostaglandin synthesis at the site of injury. Inflammatory cells expresses integrity and effect. So this drug affects the growth factors and also interleukin-6 lymphocyte transformation factor, and also stabilization of leukocyte lysosomal membranes, and the antagonism of certain actions of kinin may be contributing to the anti-inflammatory effect. So it is also a good as for purpose of antipathogenic. It prevents TX aggregations, so they prevent coagulations. The other one is that they are very good in ductal as the golden second in life, where the ductus arteriosus closure during birth is very important. Parturition is very important because it is the one is used to bring out in the uterus, facilitate labor, and also gastric mucosa damage, also gastric pain mucosa damage are product of non-steroidal inflammatory drugs inhibit synthesis of prostaglandins, which so that means in this case that some were used in that one, so they are good for that. So the phases of prostaglandin induces mucus and hydrocarbon secretion tends to enhance acid secretion and may promote mucosa ischemia. Thus, steroid anti-inflammatory enhances aggressive factor and contain defective factors in gastric mucosa which are acidic. So anaphylaxis reactions aspirin promotes asthmatic and diuretic swelling and urticaria and rhinitis in certain susceptible individuals. This subject reacts similarly to chemically diverse and steroidal anti-inflammatory ruling out in immunological basis of this. So the uses of this drug is that they are used in rheumatoid arthritis, osteoarthritis, inflammatory arthropathies like ankylosing spondylitis, acute gout, dysmenorrhea, metastatic bone pain, headache, and migraine, postoperative pain, mild to moderate pain due to inflammation and tissue injuries, pyrexia, and renal colic. They are also given to just born infant who has a problem with ductus arteriosus, which does not close within 48 hours. So the prostaglandin synthesis is synthesized from the membrane on the cells by phospholipins, arachidonic acid, secro, oxygenase pathway, where that the prostaglandin 2 and the prostaglandin H, we have the isomers, the rhomboxin synthesis, and the prostaglandin synthesis, whereas isomers is prostaglandin E, prostaglandin D2, and F. The rhomboxin synthesis is TX1, which is converted to TXP, which is purposely for platelet and coagulation pathways, and prostaglandin synthesis is prostaglandin 2, again for immune. So the physiological of prostaglandin is that prostaglandin is for pain sensitization in bradykinin, and it promotes bradykinin pathways and histamine pathways, which are pathways of inflammation, and also for pain. It induces what we call the intrinsic pathway of inflammation, or also extrinsic pathways of inflammation, either in chronic or acute inflammation processes. Inflammation of prostaglandin 1, I, 2, and D, and E are vasodilators that can cause edema and erythematous. The protection of the gastric mucosa by prostaglandin 1, 2, and the maintenance of renal blood flow by prostaglandin E. fever from gastrointestinal and platelet and the aggregate and prostaglandin inhibiting platelet aggregation. So TXA stimulates platelet aggregation and for the purpose of clotting pathways, and also in the uterus, prostaglandins stimulate contraction in utero. This is the one which is used to induce labor. Other prostaglandins keeps ductus arteriosus open after birth. So in COX-2 hypothesis of 1990 is that arachidonic acid, then COX-2 constitutes, then physiological prostaglandin production, then normal functioning, then constitute pathological prostaglandin production leading to inflammation and pain and the fever, which is induced by cytokines and other growth factors. So the role of prostaglandins in inflammation is that it promotes development and chronoproliferation of macrophages, tends to integration of macrophages. So there is differentiation and increase in cells of macrophages to fight and to specialize in fighting. So it induces pain, fever. This is the cardinal signs of inflammation. It plays a big role in these cardinal signs of inflammations, and also it inhibits lysosomal enzyme release during phagocytosis and phagocytosis. So also very important in bone reabsorption. And the patient who have dental problem, you can also give them by if they have irreversible pulpits, apical periodontitis, acute alveolar abscess, infected cyst, sinusitis, arthritis, tooth extraction, dry socket, recurrent abscess, ulcers, and recent platters and chronicocytosis, and cyclic neutropenia are the type of patient who use this one. So in general, is that consideration you should always consider is patient with ulcers, asthma, nasal polyps, diabetes, gout, influenza, hypocoagulation state, chronic allergies, disorder, chronic liver disease, renal failure, salicylic acid allergy, breastfeeding mothers and pregnancy. You should have very careful when you're prescribing this drug to this type of people. So there are various studies about these drugs, and let us now look at various like aspirin. Aspirin is an analgesic, antipyretic, and anti-inflammatory. And the metabolic effect is that blood sugar may decrease in aspirin, and plasma-free fat acids may decrease, and cholesterol levels may reduce. So aspirin is very important for cholesterol. Acid-base and electrolyte balance compensated by respiratory process. Cardiovascular vasodilatation increase in cardiac output also happens, and GIT, gastric distress, and nausea and vomiting happens when somebody is taking aspirin. So prolonged blood bleeding also it interferes with blood rates. So the other, the side effect is like nausea, vomiting, and gastric pain, decrease distress, and increase blood loss. It is two. They can get off-cut blood. It can cause losses, fixed drug eruptions, urticaria, rhinorrhea, angioedema, asthma, and anaphylaxis reactions. Salicylic dizziness, tinnitus, vertigo, impairment of the hearing and vision, excitement, and mental confusions, and hyperventilation and electrolyte imbalance can happen in acute cases. So acute salicylic poisoning also is very fatal in a patient and adult, and 15 milligrams lower doses can do happen. So it is used in analgesics, antipyretic, acute rheumatoid fever, rheumatoid arthritis, and osteoarthritis, post-myocardial infarctions, and patent ductus arteriosus, familial chronic polyposis, and prevention of chronic cancer and treatment of Barthel's syndrome. So precautions and contraindication is peptic ulcer disease, bleeding tenderness, children with smallpox, influenza, and chronic liver disease, diabetes, and pregnancy, and breastfeeding, and mothers. The dose is 0.3 to 0.6 grams for 4 hours, and that is the recommended dose. So there is another drug called indomethacin. Indomethacin, it inhibits prostaglandin synthesis and suppresses neutrophil motility. Well absorbed orally, half-life is 2 to 5 hours. Adverse effect: gastric irritation and nausea, anorexia, gastric bleeding, diarrhea, frontoendic dizziness, ataxia, mental confusion, depression, psychosis, leukopenia, rashes, increased risk of bleeding, and contraindication in machinery operations, driving, psychiatric patient, and epileptic and kidney disease, pregnant women and children. So the dose is 25 to 50 milligrams twice per day, and you can also go all the way to QID. Commercially, it is as Indoflam or those type of drugs. So the other drug is Brufen uses propuric acid derivatives. It can cause gastric problem. It can cause CNS, dizziness, blood vision. It is avoided in pregnancy and peptic ulcer asthmatic patient. It is used generally in pains, in rheumatoid arthritis, post-operations. Doses is 400 to 800. Sometimes it is used in treatment of dysfunctional uterine bleeding, And in dysfunctional uterine bleeding, you can use brufen. The other dose is diclofenac sodium, uses iron acetic acid derivatives. Half-life is half an hour to 2 hours, and the first effect is like nausea, headache. It is used in arthritis, ankylosing spondylitis, all those types of pain, and also in surgery. There are various types of diclofenac. There are the safe ones which are used in GIT, like capsules which are potent to prevent GIT bleeding. Then you have cataloic, which is a pyroric relatives, potent analgesic and modest anti-inflammatory, rapidly absorbed and after oral and IM and nutrition. Half-life is 5 to 7 hours, and the mass effect is GIT. This nears two roses to and drowsiness and not given in patient to have anticoagulation effect. So it is used in postoperative and musculoskeletal pain and used in renal and migraine and due to body metastasis. And also the dose is 10 to 20 milligrams 6 hourly. Then we have a drug like the nimesulide, and the nimesulide is as COX-2 inhibitors. It's source acting and like injuries, dissonance, and disonder surgeries or back pain, dysmenorrhea. The other adverse effect it can cause all the problem like heartburn, nausea, loss of motions, epigastric pain, all those ones. And 100 milligrams PD is the dose. Then conclusion is that analgesics are definitely useful in reducing pain and improving the quality of life, but have their own spectrum of adverse effects. No single drug is superior to all other for every patient. Choice of drug is empirical. Thank you very much for listening to the lecture. Thank you.